rescue and the 11 major risk factors that Dr. Amen, through his research, has defined as sort of things that steal your mind. I feel like you might know a ton about this already, but for me, every time I go through it, because it's not just related to memory, it really rejuvenates my commitment to brain health. It reminds me of why I make healthier decisions when I can and when I'm able. And I'm going to have you walk away with some can-do action items that you can do in your everyday life or that you can incorporate so that you can continue to leverage the strength of your brain. So really quickly, let me clear out my emails there. So Amen Clinics, you may have heard of Dr. Daniel Amen. He's on PBS quite a bit. If I'm a self-proclaimed neuro nerd, he is the king of neuro nerds. So he has a really strong presence. He is a psychiatrist and a researcher in so many things. But in addition to doing the PBS and writing the books, he actually has 10 clinics across the country where we help serve people by doing really integrative approaches to brain health and brain imaging. So we are a functional and integrative brain-directed healthcare group. We specialize in using something called brain SPECT imaging, and I'll get into that later, as a part of a comprehensive evaluation process. Now, it could be a psychological evaluation process, it could be a brain fitness evaluation process. Strip it all down, it's a brain-based evaluation process. It's not your standard battery of neuropsychological assessments, though they do go hand in glove. So Allison and I were just speaking before this about leveraging outside neuropsychologists. And our goal and our strength is really to get to the root cause of what's, influencing, creating, worsening psychological, mental health, brain performance symptoms. And these are all really interwoven. So we're going to talk a little bit about mental health, but it's not just mental health or psychological symptoms. We're always thinking about brain health. As we know, the brain is involved in everything we do and how well we do it, how we think, how we feel, how we experience and interpret the world around us, which that's where I really got interested in the brain, was how do two people in the exact same situation, how do they experience things so differently? And then, of course, we're always looking for, is this, if it's a memory related thing or it's suspected, is it mild cognitive impairment? Is there a history of Alzheimer's? Is this actually Alzheimer's? Is this dementia? Or is it something else? And we figure that out by getting to the root cause. So a little bit about the man behind our mission. His name is Dr. Daniel Amen, and these are his 4 children. And I don't often include pictures of his kiddos. However, if you ever hear him talk, he always talks about the importance of having a why. The why really matters, and his why is his family. And you'll also notice some seahorses in the slide, and those are to remind you of a part of your brain called the hippocampus. The hippocampus looks like a seahorse, and it's very much tied to memory and how we store memory. So a little bit about his background and how we ended up here. 32 years ago, Dr. Amen started Amen Clinics, but this was after he was a psychiatrist. He's an interesting guy. He has a heart of gold. He wants to help people, and he's very curious about why things work and why they don't work. And when they don't work, he doesn't just settle. He really believes that his purpose as a physician is not to tell people what to do. Rather, if you hear him speak, he'll say, your job as a physician is to do your very best to gather all of the possible options available for a person, present them to them, and then have them choose what works best for them. So when he was practicing psychiatry, he had a lot of success. A lot of his patients got much, much better. Some of them didn't, some of them got worse. And he felt that he was ethically bound to figure out why it wasn't working, like why these pharmaceutical medications were not working for certain people, but they were working for others. He ended up going to an all-day conference on brain imaging and imaging in general. And because of his background in radiology and his passion for imaging and psychiatry, he's like, well, why aren't we imaging the brain? So he started imaging the brain, he started collecting data, and he started to find patterns. Now, in the general community back 32 years ago, there was a lot of pushback about him doing this. The research community kind of came out and said, you know, you really shouldn't be scanning people's brains. This should really only be done for research in large hospitals, research hospitals. And he goes, well, that doesn't make sense. Why are we psychiatrists, tasked with treating the brain, but yet the only medical professional who does not look at the organ that we treat? It doesn't make sense that we're not looking at the brain if we're treating the brain. A cardiologist looks at the heart. If you break a bone, you're gonna get an x-ray. I say this quite seriously. My dentist is a personal friend of mine. I adore her plenty. She's not putting a drill in my face until she takes an x-ray of my teeth and can really validate why she's doing what she's doing. So this is a philosophy that makes complete sense to me. And we deal with people who we call them like they're stuck. So that means that they've already tried a bunch of different options. They've already done other evaluations and they don't feel that they've gotten where they need to be, or the indicated intervention hasn't worked yet. So when we find people have tried a bunch of things and it's not getting better, then we want to take a look at their brain. So what is SPECT? SPECT is a nuclear medicine study. It stands for single photon emission computed tomography, which essentially means a fancy map of the blood in your brain. So we're looking at blood flow. So this image on the left, what you see is the brain from the bottom up. So you're kind of looking up their nose and into their eyeballs. The one on the right, the person is looking to the right, the one on the bottom left, looking left. And then on the bottom right, you're looking at a top-down image. In the back, the larger portion on the bottom right is the back. Now here, the colors don't matter so much. The colors do matter if we're looking at an internal active view. But for these surface scans, what we call surface scans, the color doesn't matter so much. What we're looking for is how plump the brain is. Do those lumps and bumps that we see, do they make sense for how the brain fits inside of the skull? So the lumps and the bumps that you see here are normal, healthy, average, and those bumps are not damage. Now, what we are looking for when we do SPECT imaging is something called hypoperfusion, lack of blood flow to the brain. Because a lack of blood flow, think about it in any other area of your body, a lack of blood flow means lack of function, or can mean lack of function or decreased function. So we're looking for areas of the brain that have a lower amount of blood flow when it should have a normal amount. So I'm going to save you this information, but I will send it to Allison so you have it. Here's a quick rundown of what the different areas of the brain do. Prefrontal cortex, just really quickly, forethought, impulse control, judgment, keeping you from saying the things that you know you shouldn't say, keeping it on the tip of your tongue without letting it come out. And when we have problems in those areas, we can have a short attention span. People can be impulsive. They can have poor judgment. They don't think things through. Temporal lobe issues, very generally, there's a lot more to it than this. Think of temporal and temper. Also short-term memory and long-term memory. And then also think of where the hippocampus sits in the brain. It's actually under the temporal lobes in the deeper structure. So we've got some memory related issues there. If people have issues in this area of their brain, they can, this is not always all the time, but they can, be socially inappropriate, or they might have memory issues. They might be angry. They might be quick to have irritability and dark thoughts. Parietal lobes kind of in the back-ish half of the brain. Now this one is pretty important for our conversation here. The parietal lobe and the occipital lobe, I mean, every part of the brain, but especially these three parts of the brain and memory. So your directional sense, where you are in physical space, how you fit in physical space, how you understand and sense and integrate motion and movement. And when you have a deficit in this area, you can have an impaired ability to sense where you are. You can forget where you are in space. You can have body forgetfulness. And then the occipital lobes, this is our sight. And we can have deficits in vision and visual perception. And then the cerebellum, and then its interplay with the parietal lobe with memory is huge, because the cerebellum is the most neuronally densely packed part of your brain. It takes up only 20% of your brain, but it has 80% of the neurons in your brain. So if you have issues there, you can have issues with motor coordination. You can actually be impulsive also, because there's correlations between what happens in the back of your brain and the front of your brain. You can have issues with walking. So that's a quick rundown. There's a lot more to it than that. So when somebody has Alzheimer's, this is generally one of the markers that we see. So again, normal healthy on the left, typical Alzheimer's, true Alzheimer's on the right. What we also see is that back half of the brain starts to deteriorate the most quickly. And by deteriorate, I don't necessarily mean the tissue, I mean the function and the blood flow. But this can be a marker in and indicative of what we see in Alzheimer's. So Dr. Amen's really big point is that you are not stuck with the brain that you have. You can make it better. And we can all do things now and today, including myself at my age. I use a lot of these tactics in my life to keep and strengthen the reserve that my brain has. So here are the Bright Minds risk factors, and I'm going to go over them a bunch of times. This is just a cute little outline. Allison and I will send it to you. But Bright Minds is essentially based on very simple factors. There are 11 major risk factors that steal our mind, and they are blood flow, retirement and aging, inflammation, genetics, head trauma, like physical trauma, toxins, mental health, your immune system and past infections, neurohormone deficiency, your hormones, what we call diabesity, which is a blend of diabetes and obesity, and a huge factor, sleep. Sleep, sleep, sleep. So I'll go over it a bunch of times, but that's the mnemonic, Bright Minds. Blood flow, retirement, inflammation, genetics, head trauma, toxins, mental health, immunity, neurohormone deficiency, diabesity, and sleep. So we've already gone over a little bit of blood flow. And here's some simple tips. Get your body moving, do motor coordination. We don't love contact sports at Amen Clinics, but we love table tennis, because what it does is it actually activates your cerebellum, and that doesn't matter what age you are. Tennis, table tennis, walking, specifically walking like you're late. Dr. Amen talks about this. When you walk somewhere, walk like you are late to wherever you are going. Increasing blood flow to any part of your body increases blood flow to your brain. Get up, move around, you increase the blood flow in your body, you increase the blood flow in your brain. Retirement and aging, this is a really big one. So we often see, I'm going to skip that story for now. Actually, no, I won't. Yes, I will. I'm going to skip that story. So when we retire and we stop learning and we stop our routine, people oftentimes can become depressed, because we look forward to retiring, but then we retire and then we don't learn as much, or we're not doing as much. People will become isolated. So we have a big belief that when you retire, if you retire from work, that your job becomes new learning, new languages, activating the parts of your brain that need and thrive on education. So when you stop learning, essentially your brain starts to die. So new learning often improves benefits, it has proven to benefit memory, it lowers the risk of dementia and Alzheimer's. And I've also put some peer-reviewed studies in here for you guys to look at later. So like our face, our brain ages. Part of that is normal, but we can kind of slow it down, right? I mean, women moisturize their face a lot more than men do, and we get why, because our skin ages. Well, our brains age too. So this is sort of what we see as a normal aging process, but also this isn't great, and this doesn't have to be this way. So 35 to 55 to 82, that this is generally what we see in aging. So if you can get ahead of it and slow it down, then you will have a longer brain life. Ways to do that. Let's move into the next risk factor, inflammation. There's super easy ways to address inflammation. And I'm going to go through other tips as well, but eating really high quality salmon twice a week, or having high quality fats, walnuts, avocados, eating food that is high, healthy fat, high, but not farmed. So if you, Dr. Kidd, who is our chief formulary, says that if you can get 2 high quality sockeye salmon, wild caught meals in per week, you may not need to take an omega. I just take the omega because I don't go to the store often and find myself, wild caught sockeye salmon, no dye. You do from time to time, but I take an omega every single day to help improve the quality of my brain. So high omega levels can also, not unhealthy levels, but higher omega levels can also reduce inflammation, and you can get tested for that as well. Here's some peer-reviewed research on that, where we actually can see that the higher omega-3 levels, and again, everything in balance, not too much of anything, but it can actually heal the hippocampus, which is where, it leads to a healthier hippocampus. And that's where our long-term memories are stored. That's our big why. Genetics. So understanding what you have before you are even here. I have some psychologist friends who talk about like the ovum that became you and all of the impacts to your long-term health before you were even born. So there are ways to test to see if you have a risk factor or a marker if you've already had it in your family. So also we talk about, doing a SPECT brain scan. If you think you're having memory issues, but you're not quite sure if you're just distracted or overwhelmed, but you have a history of Alzheimer's in your family or memory related issues in your family, and you really want to know what's going on to get ahead of it, that is a reason that people will come in and get brain SPECT imaging. Blueberries, super, super simple thing to do. Incorporate dark leafy greens and blueberries into your ongoing daily supplement regimen. So head trauma, this is a big one. The brain is soft, super soft, pretty squishy. Kind of think of if you made oatmeal, didn't eat it all, and then left it in your sink with a little bit of water for an entire day. You could pick it up, it wouldn't totally slip through your fingers, but if you squished it at all, it would fall apart. That's what your brain is like. It sits inside of your skull and it is not anchored down. So head trauma is such a big thing when it comes to memory, because sometimes it's not actually memory. Sometimes memory is impaired, but it's as a function of a physical injury to the brain that impacted the brain's function. So one example of that is whiplash. People get brain injury all the time from whiplash, with or without a diagnosed concussion. Football, soccer, women have a much higher rate of receiving long-term brain injury as a result of whiplash-like injury. Some research is coming out about that because of physical neck strength. Women do not have necks that are as beefy as men's. So wouldn't it make sense that when we get in a car accident that we sustain more brain injury? Wouldn't it make sense that women who are playing soccer get way more brain injury that, and it also goes undiagnosed a lot of the time because concussion protocol is still relatively new in women's soccer. So when we think about brain injury, try to expand your belief about what brain injury is and what it looks like. Because if your brain sloshes around inside your skull and hits the front of your skull, you can get a brain injury. Furthermore, which leads us to another risk factor, is that can impact your hormones. Your pituitary gland is a very small gland that sits on the inside of your brain. When your brain wobbles around, so does your pituitary gland. And if it gets injured, it can result in or become hormone issues. It's your master gland. It controls your thyroid. It controls all of these other things that actually impact memory and mood. We did some research on this. We actually did the first and largest NFL brain injury study on former retired and active NFL players. And what we saw was that overall, their brains were significantly damaged. But that's not where we wanted to go with the research. We wanted to see if we could help improve their brains. And we did with, and this right here, where it says active and retired NFL studies, this is actually a link to that study, to the research. And what we found was that people's brains improved. Their brains improved when we put them in a healthy, healing environment, when we helped them take high quality supplements, when we had them do things like hyperbaric oxygen, when we informed them and then they made changes around drinking and sleep, their brains dramatically improved. And these are some of the most damaged brains that you can think of seeing. So again, I want to circle it back to the point is that your brain's history is not your brain's destiny. There are things you can do to heal your brain. There are things that you can do to get ahead of your brain's aging. And if any group of people can show that, it's definitely NFL players who have had their heads bonked into for an entire career. This is one of my favorite stories. His name is Anthony Davis. He was called the Notre Dame Killer because he scored a bunch of touchdowns in, I think, the 70s and went on to play professional football. And he was driving down the road in Orange County, and all of a sudden, however long later, he found himself on the side of the freeway. Lost time, didn't know what happened. And so we had him come in and he worked with Dr. Amen, and his brain scan was pretty bad, pretty injured, lots of hypoprofusion. He was having major mood issues. He was having memory issues in decline, didn't know what was going on. He changed the way he lost a ton of weight. He started eating healthy, taking supplements, doing hyperbaric, improving his sleep. And after a period of time, 10 years later, 10 years, I mean, and now this I got to give to football players and athletes. You tell them what to do and they do it. And he did it. And my gosh, look at his brain. Now, these are the same parameters, the exact same thresholds. The only thing that was different was how he started to treat his brain. So if anyone can improve, again, it's definitely somebody like him. So to the T in Bright Minds. Toxins. This is such a big one and such a simple one. So your skin is your largest organ of detox. So I want you to take this mantra away with you. What goes on your body is in your body. What goes on your body is in your body at a cellular level even. In fact, there's research coming out for firefighters that at a cellular level, what's happening inside of their bodies, because there's three main killers of firefighters, specifically that group of first responders: cancer, heart disease, heart attacks, specifically like within 5 years of them retiring, and cancer. And they kept thinking that, okay, maybe it's the cancer from, and they were wearing unhealthy, they would wear their dirty fire turnouts back to the station. They didn't have protocols in place before. And so it's what they're breathing in that's changing them at a cellular level, and it's what's on their skin and on their clothes. Well, now fire departments have caught on to this because so many firefighters die from cancer. Turnouts are not allowed to be worn unless they are on a fire. As soon as they are back from a fire, they use a detoxing scrub that pulls the toxins out of them to the best of their ability. Now, what they're also finding specifically for firefighters is because it's in them at a cellular level, unfortunately, whatever it is that's happening inside of them is reactivated by a sauna. So for that group, after a fire, sauna's no good. For pretty much everyone else, saunas are great. I have a far infrared sauna in my room. If I feel like I'm getting sick, or if I feel like I've been around somebody who's sick, or if I just need a good detox, your skin is an organ. Let it detox. Now, here's another thing about toxins. Sunscreen, and this is going to go into neurohormones. Sunscreen can be quite toxic. So what you want for sunscreen is you do want protection, but what you want is a physical barrier or a mineral barrier. So keep an eye out for an ingredient called oxybenzone. Oxybenzone is it's a hormone disruptor. Specifically, it's a hormone disruptor for testosterone. And testosterone has an implication in memory. So these are all simple little things that we can do to get toxins out of our life and increase our brain health. Mold. Mold is a huge one. If there's even a chance, a slightest chance that you've had a water leak in your house, or you know that there's some mold, get it officially tested, have it properly remediated. There are many situations where we have had people come in for memory issues, for cognitive decline, for mood issues, and they actually have mold in their blood. When we clean that up, their lives drastically improve. Okay, so also another piece of toxins is substance use, abuse, and dependence. Now, if you look at somebody who is using substances and you see these, pockety, speckly looks to their brain scan, then it makes sense to us, that their brain is being, it's toxic. That can generally be fixed. Now, here's what's interesting. If we see somebody and their brain looks like this, but they're not using drugs, they are not drinking, they don't have substance use issues, we think, where's the toxin at then? Where is this coming from? So then we'll start to go through the potential toxins in their life and try to get them out. Here's some more research. We did some research on long-term marijuana users, and let's just get there. Marijuana is not good medicine necessarily. Now, I'm going to be very careful with that. Few are dying of cancer, and that's what's getting you to eat. Like, let's choose our battles. But as a first top 15 to 20 interventions, marijuana is not good medicine, because research actually shows that marijuana users have lower blood flow in the brain, and they perform lower on every cognitive task that they are tested on. And then I'm going to talk a little bit about toxins, a little bit more actually. So here's a quick story. So Lou was married for a while, long time actually, and he was a cabinet builder, but he wasn't always a cabinet builder. And when he came in, because he and his wife were really having problems, they were pretty much kind of at their end, and somehow they got connected with Dr. Amen. He saw them, and then Dr. Amen asked, like, well, when did things change? He asked his wife, when did things change? Like, was he always a jerk? I can't imagine you married him like this. She's like, no, it started when XYZ. Well, it started relatively close to the time that he started building cabinets and finishing cabinets, and it was around fumes all day long. And as it turned out, his brain was pretty toxic. They got it back in order, and so far so good. They're living a pretty happy life. Now, it's still not perfect. There's still some scalloping. There are still some issues, but it is undeniable how much it improved after only 5 months of removing toxins, doing hyperbarics, doing all of the things that are needed to improve brain functioning. And then into a really big piece about mental health. And all of these things fit in together. Mental health ties into retirement, aging, and isolation. Mental health fits into substance use abuse and dependence. Mental health fits into how we treat ourselves. Are we willing? Dr. Amen talks about this a lot, and I always want to learn more from him. But he says, like, I don't do things like that because I love myself. Like, I don't drink alcohol because I love myself and I want to be here to love my family. And so everything that we do really is impacted by mental health. And we actually don't love the term mental health. We like the term brain health. We believe the whole concept of mental illness, it's become so stigmatized that we really believe in just kind of ending the term mental illness, mental health, and we're focusing more on brain health. So some things that you can do to just improve your overall mental health: take a beat, say a prayer, take a minute, meditate, talk to a professional. If you need help, get it. Walking in nature, it does something to our minds. It's really big. It connects us to something bigger than us. And watch your thoughts. You know, he calls them ants, automatic negative thoughts. When you hear the little Lolita in your brain, you know, kind of putting you down, talk back to it. And all of those things impact mental health. And then it's really quite a bit larger than that, of course. So things that impact, you know, mental health, we kind of know this stuff, right? Chronic stress, emotional trauma. Emotional trauma actually has a huge implication in the physical and functional function of our brain. Grief, depression, bipolar disorder, and ADD and ADHD. So inattention, you know, if you feel like you can't attend to things, you can't concentrate, it can really kind of ding your mental health. So I want to tell you another story about when something was not Alzheimer's, but instead it was actually mental health. This is David. On the left, again, I showed you kind of what we see in classic Alzheimer's in the brain. And David was diagnosed with Alzheimer's, was told essentially, you know, get your stuff in order. And this is actually Dr. Amen's wife's father. He's since passed away, not from anything related to Alzheimer's. He died of leukemia. But when Dr. Amen met with him, because they had been estranged for a long time. Dr. Amen's wife's name is Tana. They had been estranged for a long time. And when he met with him, finally, he's like, this doesn't seem like Alzheimer's to me. I think that there's more going on. Well, he didn't have Alzheimer's. No, his brain was not perfect, not by any stretch. He was depressed, and he had been depressed for a very long time, but had gotten very bad to the point that he then couldn't do what was his passion at the time. And that was, you know, working in churches and being, you know, a pastor. That was important to him. And when that stopped, he got extremely depressed. So long story short is that Dr. Amen and Tana worked with him, got him on medications that actually made sense for his depression, got his other health factors under control, did the same Bright Minds approach with him, and he went on to live a bit more of his life before he ended up, you know, getting ill with Alzheimer's. And there's more to that story, but it's worth mentioning that sometimes things look like Alzheimer's and they're not. And here's some actual research on that. There's a ton more. You can probably find more on PubMed, but this is out of the Journal of Alzheimer's Disease, where it talks about that depression and dementia can be, you know, distinguished using brain imaging. Immunity and infections. So this is a big one. Infections create inflammation. Inflammation literally it translates to set a fire. So when you have an infection or when you have a lot of inflammation, it's like your system is kind of on fire. So it's important to understand what you have going on. And if you think you've got other viruses going on, specifically things like Lyme disease or mold or a bunch of other, you know, I won't get into all of the other things, but also take vitamin C, boost your immune system, eat healthy leafy greens, dark detoxing foods, and then simple things, vitamin D. Get your vitamin D tested and make sure you're taking enough vitamin D. Use a good probiotic. Give your body and your gut the chance to fight off infections. Or if you have to take antibiotics, make sure that you also take pre and probiotics in an appropriate time. I'm not a doctor, I won't get into all of that. But you can look into how to take pre and probiotics if you have to take antibiotics, because when you take antibiotics, it's great because it will kill the infection. There's nothing wrong with antibiotics, but it kills all the bugs in your gut. So you want to get those healthy bugs back. And I could talk more about that at maybe a different time. Onions are really great. Mushrooms are super detoxifying. And then here's a little bit more information on brain-directed nutrients and how they enhance blood flow and memory and brain function. And then here's some other nutraceuticals to look into. Ginkgo, it supports blood flow. Omega-3 fatty acids, and also saffron improves mood. Probiotics improve immunity. And neurohormone deficiency, eat brassicas, lift weights, and get them tested. Your testosterone, your thyroid, your DHEA levels, which help fight aging, and that's why you would take an omega. Your estrogen and your progesterone, huge for understanding blood flow. And I'm gonna snooze that for a second. Understanding blood flow and brain health. Test them regularly, avoid hormone disruptors, pesticides, phthalates, all of those toxins we talked about earlier. Talk to your doctor, ask them what sort of blood panels they are running. Control your weight to the best of your ability. Research actually shows that as your weight goes up, specifically your mid region, the size and function of your brain goes down. And this is why this is important. This is not about body bashing or fat shaming or anything like that. Fat is not benign. It's actually a storage area for toxins. So understand your BMI, understand, and it's not so much weight, it's the level of unhealthy excessive fat. I want to make a very clear distinction about that. Weight, not so much as your, how much body mass you have in comparison to how much unhealthy fat you have. So just little small changes can improve that. And then of course, sleep. I'm going to end with sleep and just say, anything that you can do to improve your sleep, taking magnesium, using lavender, using relaxing music. If you snore, suspect that you have sleep apnea, get it tested and get on the right indicated interventions, because it can really improve the quality of your brain. Things that hurt, of course, coffee. If you have a room that's too hot, if it's too noisy, alcohol, it'll put you to sleep, but it'll wake you right back up because it's a depressant in the short term, an activator within a couple of hours once the half-life starts to go away. Magnesium, some supplements. I don't want to make any specific recommendations here. And then of course, if if things aren't improving, come in for an evaluation or, work with Allison. She's got wonderful resources, as you know, but our memory evaluation is pretty extensive. It lasts a long time. We do brain scans, we do labs, we do testing. We have tons of follow-ups. So if you're not getting where you think you need to be and you've tried a bunch of different options, that's a great place to start, or that's a great place to go. And that's all I have. I will send all of this out. Thank you